Hello, my name is Jacqueline. I'm First Aid Trainer for National First Aid courses. Today we're going to look at CPR on an infant. God forbid you should ever be in a position where you need to give CPR to an infant, but even more so, God forbid that you wouldn't know what to do if that happened. So today we're going to look at what to do when it comes to providing an infant with CPR. Firstly, you would always follow your doctor's ABCD. This is an acronym that first aiders must follow with every first aid emergency. There are people in the hierarchy that collect incident reports and reviews, and they have found out first aiders forget to do things or forget to do them on time. And this has become quite costly to the casualty. And one of their solutions to the problem was to provide us an acronym, and over the years to add another letter to the acronym. So we're up to 7 letters now. They're quite easy to remember. Doctors is a medical reference. ABCD is a system. This is a medical system you really should follow to make sure you do every important thing on time. The first letter in the acronym is D, check for danger. Straight away. Is this a safe place for me? Is this a safe place for me to care for the child? Firstly, make sure you're safe, and then make sure that this is a safe place to care for the child in a CPR. We're on a table, so I would say no, not safe. We should be on the floor, but that's not going to work for you, is it? You won't see me down there. So check for danger. I've checked for danger. I cannot see, we're looking at possible gas smells, possible sight visions, things that are encroaching fires, all sorts of things. And now that I've established, no, this seems like a very safe place to me, I will move on to the next letter, which is response. Does the child respond to me? Now, a lot of people think to check breathing here. We are not looking to see if the lungs respond. The R is, does the brain respond? We're just looking, do they respond to me? Back of the hand first, because if they have electricity in them and you do front of the hand, you could end up being stuck on them, grabbing them, and your hand will clench up. Back of the hand first. Can you hear me? Hello, talk to me. Using words and touch, little clavicle rub. Childcare workers recommend rubbing the ears will get a response. Under 6 months, putting your finger in their hand will actually, if they're conscious, they will respond by grabbing you. If they're not conscious, there will be no response from a child under 6 months. The feet tend to have the same thing. They will curl over and try to grab you. Tickling the feet, all right up to 1-year-old, will work. Anything you can do to get a response. No response, then your next step is somebody call an ambulance, send for help. Try to get somebody to do that. Terrible if you're on your own. At least we have mobile phones and loudspeaker now, which makes things better. But try and get someone to call an ambulance and let them do the job of calling the ambulance. I'm going to do the job of checking the airway. Once again, checking the airway is not checking breathing. We only do checking breathing on B, and then we keep on checking breathing for the rest of the event. Checking the airway means looking in their mouth and making sure it's clear, making sure there's nothing in there. What's in there? Because that's another hazard and risk. This is another check for danger. If something is in there, I mean, the child could, if they take a breath, they could breathe it into their lungs. If I blow a breath into this child, I could blow it into their lungs. They could choke on it. So we really need to make sure whatever's in their mouth needs to come out. Now with a baby, we don't need to put our finger in our mouth and do any finger sweeps. We're going to put the baby in what's known as a recovery position. In a baby recovery position, we use a lobster claw cheek to cheek. Our hands are going to provide support here on the cheeks, like a lobster claw, and our hand comes down and forms like a splint or a brace to stop the neck from bending. We do not want to bend a baby's neck, ever. It cuts off their windpipe. So we really need to make sure this stays straight. So I've got a lobster claw, my hand coming down, the baby's on my forearm, and then I put them over and tilting them down slightly, get whatever's in their mouth out. I might need to use my thumb to open the mouth a little bit, but gravity's on our side this time, and this is going to fall out. When you've got whatever's in their mouth out, make sure it's all gone. Yes, that's all gone. Now we are going to do the B, which is checking their breathing. With an adult, we would tilt the head back quite a lot to listen for breathing, because that tilt will open the airway. Do you know what will actually close a baby's airway? It will do the opposite. You don't want to be tilting their head and saying, oh, they're not breathing, let's do CPR. Well, they were breathing until you tilted the head back. Leave the head. Put your ear next to their mouth and put your hand on the chest. I can hear breathing, if they were. I can feel breathing, if they were, and my hand would be going up and down. But if I get nothing, no breathing at all, then of course I'm going to start CPR. If I get very unusual breathing or gurgling and rattling on an unconscious person, including a baby, weird breathing or gurgly, rattly sounds is an indicator that they're shutting down. These are not good signs. This is an indicator they need CPR. Their heart needs assistance. So either no breathing at all, or unusual breathing, weird breathing, struggling breathing on an unconscious person. Don't throw someone having trouble breathing down on the ground to give them CPR. If a person is unconscious and having trouble breathing, then that's a sign that they need CPR. Now, CPR for a baby, like an adult, is under the arm and to the middle. Now, with the adult, we use the heel of our hand and we push really hard right where those fingers land in the middle, right in the middle of the chest. With a baby, we're not going to do that. Look how much that covers. You're going to squash every living thing inside that baby. So what we're going to do is, to match the size of the heart, we're going to use 2 fingers right in the middle of that chest. Under the arm, to the middle, right in the middle there, 2 fingers. And you will push 1/3 of their depth. 1/3 of their depth. If you're thinking, oh, that seems a bit hard, that's not very kind, I might go a bit softer. If you go a bit softer, it could be detrimental. CPR is not keeping someone's heart beating until the ambo arrives. Keeping their heart beating is not what you're doing. That's useless. What you're doing is doing what the heart is meant to do. You are pushing oxygenated blood to all the vital organs, and the organ we worry about the most is the brain. This is the one that you've really got to protect. So 2 fingers in the middle, 1/3 down is being proven scientifically is what's required to push the blood up to the brain area and keep the brain alive. Once they lack blood up into the brain area, they can suffer brain damage or death if we do not get blood up into the brain. 1/3 down. And when you're 1/3 down, you will now count. You're going to imitate a heartbeat. We really want to imitate a heartbeat, which is 2 beats per second. My favourite is 1 1,000, 2 1,000, 3 1,000, 4 1,000. Counting that way ensures that we're actually doing best practice. You don't want to be too fast. Too fast may not give the heart enough time to refill and get a good push up into the brain, and too slow just may not be doing the job well enough. We've got to go 1 1,000, 2 1,000, 3 1,000, 4 1,000. And like an adult, we're going to do 30 pumps. 30 pumps before you stop and give 2 breaths. Now, when we give 2 breaths to a baby, with an adult, if you've done adult CPR, we squeeze the nose so the air doesn't escape and pull the head back. I've already told you we're not going to tilt a baby's head. That will close the airway. And we're not going to tilt the nose either. We're going to make like a mask with our mouth. A mask that goes over the mouth and the nose. 1 breath. 2 breaths, and blow air into their lung. You do not need to blow much. Whatever's in your cheek will be enough. They've got little lungs, so whatever's in your cheek is enough. Enough like you're just trying to blow a feather. You can put your hand there and you can feel the chest come up, and then you will know that you've blown enough air into their lungs. Just a little bit of air. You shouldn't be using more than what is in your mouth. And after your 2 puffs, straight back into. You might need to use your other 2 fingers. I am now because I got a bit tired. But make sure they're on top. We don't want to use too much area. Back to 30 pumps. When the baby recovers, we hope, you will stop. A big sign of recovery is vomiting. It could be they lift their hand, they open their eyes, but if they start to have some response, and vomiting is a response. The stomach doesn't vomit without the brain sending a message. So if they vomit, they're conscious. So if the baby recovers, what you're going to do is throw them straight into recovery position. The lobster claw on the cheeks, the hand coming down forming a splint over the arm. Tilt them slightly downwards, because if they do vomit, we need it to come out. We don't want it stuck in the throat. Put your wrist underneath so you never stop checking their breathing. We don't want the ambo to arrive and say, you say, yeah, they recovered, they were breathing about 5 minutes ago. You need to never stop checking their breathing. 2 minutes without breathing is when real damage starts to happen. So you need to constantly check their breathing. It would not be too unusual. I know with adults, it's not too unusual that they go back into cardiac arrest even after they've recovered. That's why you need to constantly check their breathing. You may have to go back into doing CPR if their breathing stops again. So keep checking it the whole time until the ambulance comes. That's it. Thank you.